Good day. Thank you for standing by, and welcome to the COVID-19 media briefing call. At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during that session, you will need to press star 1 on your telephone keypad. If you require any further assistance, please press star 0. Thank you. I would now like to hand the conference over to your speaker today, Mr. Mike Schomer. The floor is yours.
Thank you for joining us for the COVID-19 media briefing call for November 16th, 2021. Today we'll start with opening comments from Health Commissioner Jan Malcolm, followed by comments from Education Commissioner Dr. Heather Mueller and Dr. Sheldon Berkowitz, President of the Minnesota chapter of the American Association of Pediatrics. We also have MDH Infectious Disease Director Chris Ersman on the line with us. After those opening comments, we'll take questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. I'm very sobered and sorry to say that today Minnesota is reporting 10,913 new new cases of COVID-19 and 51 deaths. I think as folks know by now, the numbers that we report on Tuesdays now reflect activity over multiple days coming out of the weekend. So these are not one-day totals, but they still represent a deeply concerning high level of COVID activity that I think most Minnesotans would be surprised, shocked perhaps to hear that Minnesota is now the fastest growing COVID hotspot in the country based on the number of cases that we have per 100,000 people in Minnesota. So with these additional numbers from today, this brings our cumulative total to 857,791 laboratory confirmed cases. And we've passed another grim milestone of 9,000 deaths from COVID-19. Total is now 9,047 deaths. All Minnesota counties, except for one, and that is Lake of the Woods, are still in CDC's highest transmission category. And that really means that all of us in Minnesota should be masking up in indoor public settings. Hospital capacity is even tighter than when we provided our update on this call last week. Currently, Minnesota has 1,348 COVID patients hospitalized, including 307 in the ICU. These are numbers that we haven't seen since late December last year. Overall, hospital beds, staffed hospital beds, to be specific, are extremely tight. 1% of staffed beds are available in the metro region and 4% in the southeast. Availability is also in single digits across the central and northern regions of the state. ICU beds are even tighter, with only 2% of ICU beds available in the metro and 4% in central and southeast Minnesota regions. Pediatric hospital beds also remain in critical supply. Currently, there are no pediatric hospital beds available in the northwest or south central regions of our state, and no pediatric ICU beds available in the central region. And of course, these numbers about staffed bed availability, while concerning to every Minnesotan, only tell part of the story. We also have the extraordinarily high human toll this level of activity, this sustained high level of activity is taking on our healthcare workers, who are certainly our most important, but also our most finite resource. In better news, we now have 70.5% of all Minnesotans aged 12 and up who have completed their vaccine series. When we add in the population down to age 5, which is just, as you know, recently eligible in the last 10 days or so, we have nearly 64% of that expanded population, 5 and up, who have completed their vaccine series. We've been monitoring the national conversation around booster doses very closely over the last few weeks, and especially some significant developments in just the last few days. The data remain clear that all 3 COVID vaccines are very effective, especially at preventing serious illness and death. The evidence is also increasingly clear that boosters for all adults given at the appropriate time from the primary vaccination series can help to strengthen that protection longer and maintain it at a higher level, particularly with respect to the ability to become infected and to transmit. Given the alarming surge in COVID cases that Minnesota is facing, with the current case levels that we have, and as we now head indoors for the winter and gather for the holidays, this booster protection is particularly important and timely. We need to do all we can to make sure that all Minnesotans have the full benefit of vaccine protection to help themselves, their communities, and our entire state get out of the grip of this fall COVID surge from the Delta variant. So it remains a high priority, very high priority for all Minnesotans who haven't gotten vaccinated at all yet to get their primary vaccination series as soon as possible, and also to take advantage of boosters as we are expecting based on conversations with federal officials. And we've been having lots of conversations about the need and the importance to expand booster eligibility to all adults 18 and up. We're optimistic that the message from Minnesota and many other states has been heard and that the federal government is close to announcing that expansion. However, I would say that given the very serious circumstances we're here in Minnesota, we've been communicating with our federal partners that we're preparing to move ahead independently this week to expand booster eligibility if there is no action at the federal level, which we definitely hope there will be this week. Minnesota, at last report, was currently second among all states in booster doses so far administered. So we are grateful that Minnesotans are seeking out the opportunity to get booster doses and look forward to that eligibility expanding. We'll always prioritize the health and safety of Minnesotans, and that makes sure, and that means making sure that they have the highest level of protection possible for COVID-19. I'm joined again today on today's call by Minnesota Education Commissioner, Dr. Heather Mueller, to share an update on some messages that we sent out this week to parents of K-12 students and also to K-12 school officials. Our two agencies worked in partnership with the Minnesota chapter of the American Academy of Pediatrics, whose president, Dr. Sheldon Berkowitz, is also on the call with us today. Together, we sent letters urging schools and parents alike to use the full set of tools at their disposal to help reduce COVID transmission in schools and keep in-person learning in place for as long and in as many locations as possible this school year. As we described in the letter to school officials, it is true that children are generally less impacted by COVID-19 than adults, but they are still at risk for severe disease, hospitalization, and tragically even death. About 1 in every 100 children with COVID-19 ends up in the hospital. It's often also the case that a child with COVID becomes a source of transmission into households with COVID, including parents and siblings. Since school started this fall, we've seen an alarming rise in childhood cases, a subsequent rise in hospitalized children and children admitted into intensive care, and sadly, one student has died. Additionally, 8 Minnesota school staff have become infected and died of COVID since school began this fall. We need all of our schools to implement key mitigation strategies so that children and school staff are not put at undue risk. In the letter to school officials that Dr. Berkowitz and I co-authored, we urged them to make sure that all schools follow the current Centers for Disease Control and Prevention, CDC guidance for COVID-19 prevention in pre-K to 12 schools. We are all beyond tired of this pandemic, but it is clearly not even close to over. We must take this pandemic seriously and prioritize our children's health and education so they can continue with in-person learning. To give our schools the best shot at that, we recommend the use of multi-layered mitigation strategies. Those layered strategies include 9 specific points. First, promoting vaccination. Anyone eligible for vaccine, teachers, staff, parents, and children now down to 5 years and older should be vaccinated. Second, universal masking. The CDC, the American Academy of Pediatrics, and the Minnesota Department of Health all recommend universal masking in all K-12 schools. All schools are urged to adopt a policy requiring universal masking for students, faculty, and staff and guests. Third, physical distancing. Schools should maintain at least 3 feet of physical distance between students within classrooms whenever that is possible. Fourth, staying home when sick. This is an important one, and we know it conflicts with the lifelong habits many of us have developed where we just tough it out if we have mild symptoms. Well, things are decidedly different during a global pandemic. Staying home when sick with COVID-19 is essential to keep infections out of schools and prevent spread to others. And to that end, we urge schools to adopt a policy requiring students, teachers, and staff to stay home if they have COVID-19 symptoms or test positive for SARS-CoV-2. Anyone with symptoms should be tested and stay home until their test results are known. If someone has COVID-19, they should stay home for at least 10 days. Vaccinated people do not need to quarantine, and when both the primary case and contacts are masked, students do not need to quarantine. This is one more advantage of vaccination and universal masking. With respect to screening testing, number 5, schools should implement a program for voluntary screening testing of unvaccinated students, teachers, and staff. In addition, regular frequent testing of students in sports and other high-risk extracurricular activities can help to reduce spread. Number 6, contact tracing and quarantine. These remain essential tools. Schools should develop a plan to support contact tracing and enforce quarantine recommendations made by health officials. Number 7, ventilation. Ventilation improvements that bring fresh outdoor air into a building alongside other preventive strategies can also really help to keep viruses from concentrating inside a building. Number 8, notification of cases. School boards and other school leaders are reminded that it is required that they report to the Minnesota Department of Health any known COVID-19 cases under Minnesota rules. Number 9, additional layers of prevention. Schools should teach and implement appropriate hand washing and cover your cough habits and ensure frequent cleaning and disinfection of surfaces at schools. We've been talking about these things for quite a while now, but we just sent these letters this week to encourage school officials and school board members in the decisions they need to make to give them accurate and up-to-date information and remind them that these multi-layered strategies give their students the best chance for a safer in-person school year with fewer interruptions. And with that, I'm pleased to turn it over to my colleague, Commissioner Mueller.
Thank you, Commissioner Malcolm. Good afternoon, everyone. As Commissioner Malcolm shared in her update, we are continuing to see cases of COVID-19 rise across Minnesota, which is making it more important than ever to double down on protecting one another and keeping our school communities as safe as possible from the virus. I'm incredibly grateful for the work of our school leaders, educators, staff, students, and families that they have done throughout the pandemic to ensure that our school buildings are safe and that they are continuing to ensure that we are working to provide their academic support, their behavioral support, their social emotional learning, as well as their safety and health. I am also, as always, thankful for the partnership with our colleagues in health, both at the state and the local level. At the Minnesota Department of Education, we communicate with school leaders and educators regularly, and we appreciate those conversations and the feedback that we are able to get from these experts as they support our students and families every day. In addition to this ongoing communication with educators, we are always looking to expand our approaches to communicate directly with students and families. We've received many inquiries at MDE from families seeking information about the MDH best practice recommendations based on the CDC guidance, the COVID testing options, and more recently, vaccines. In an effort to respond to these inquiries and to be transparent and clear with Minnesota families about what MDH recommends and what the CDC recommends for local health strategies, as well as areas where the state provided resources for access to vaccine and testing, I sent a letter to Minnesota families with school-aged children, sharing my appreciation for their support and resilience and outlining the ways that students and families can keep our school communities healthy and safe so that our students can continue learning in person. This letter is also available in multiple languages to ensure that it is accessible to families that do not speak English, and families can expect to get this letter in the mail between tomorrow and the end of this week. As much as we need our schools to implement policies that require the mitigation strategies outlined in MDH's best practice recommendations, we also need our students and families to support those policies by wearing a mask to school, getting vaccinated, participating in regular COVID-19 testing, and doing all of the other things that continue to be important, like physical distancing and hand washing. Again, I want to say how much I appreciate all that our students, families, school staff, and school leaders have done throughout the pandemic. Together, we can keep our schools safe and healthy while keeping our students in their classrooms where we know that they need to be. And with that, I am going to hand it over to Dr. Sheldon Berkowitz.
Thank you very much. Commissioners Malcolm and Mueller, thank you for inviting me to join you today to talk about the ongoing need for COVID vaccinations and COVID mitigation to help protect our children and youth. My name is Sheldon Berkowitz. I am a pediatrician at Children's Minnesota, and as mentioned, I'm the current president of the Minnesota chapter of the American Academy of Pediatrics, representing 1,000 pediatricians around the state. Positive cases of COVID-19 continue to be very high in all three pediatric age ranges, 0 to 4 years old, 5 to 11 years old, and 12 to 18 years old. Thankfully, we now have a preventative measure to help protect the 5 to 18-year-olds by vaccination. Unfortunately, that is not yet available for our youngest children, less than 5 years old. Weekly positive cases from schools, childcare, and youth-serving programs are at their highest in almost 4 months, and the positivity rates are also very high. School clusters of new cases continue to go up. So far, there have been over 175,000 cases in persons younger than 20 years old in Minnesota alone, including 4 deaths since the pandemic started. And I wanted to share 2 really staggering statistics that just came across my desk in the last hour. The first is that the American Academy of Pediatrics statistics show an increase of 122,000 children's cases of COVID-19 during last week alone, marking a 22% increase compared with 2 weeks ago. And that's the 14th week in a row that COVID-19 cases are above 100,000 for children. Those numbers are staggering. All of this speaks to the importance of doing everything we can to control the spread of this disease in the state and in our schools. At the hospital I work at, Children's Minnesota, over 640 patients have been admitted with COVID since the start of the pandemic. Yesterday, as Commissioner Malcolm mentioned, a letter went out from her and myself in my role as president of Minnesota AAP to all school superintendents and school board members around the state, urging them to follow CDC and MDH guidelines around COVID mitigation so that all our students can continue to learn in safe, in-person school environments. The measures outlined in that letter are not new. They are the same measures that have been recommended for over a year now, and when followed can help to limit the spread of this virus in our schools. They include, but are not limited to, the following: vaccination. This is clearly our best chance to truly get this virus under control. Not only by vaccinating our young people 5 and older, but also all school staff and our children's parents and caregivers. In the 8 days since vaccinations for 5 to 11-year-olds became available, over 30,000 children have received their first vaccinations, which is great, but it's only 6% of that age range. Currently, 50% of 12 to 15-year-olds and 60% of 16 to 17-year-olds are fully vaccinated. Again, having this many young people fully vaccinated is wonderful, but it also leaves a lot of room for improvement. Vaccines have been proven to be safe and effective at all the ages that they have been approved for. This is why physicians and healthcare providers are recommending them for our patients. Next, universal masking. When used correctly, this continues to be a very effective method of preventing the spread of the disease, and it's strongly recommended to be used in all schools by all students and staff. Vaccination is not an excuse to stop masking. Third, staying home when sick, not just with COVID, but with any virus. This is not new and has always been a mainstay of good public health. And if there's a possibility someone is ill with COVID, then testing and isolation of positive for COVID is essential. And finally, quarantining at home for anyone unvaccinated with exposure to someone positive for COVID is crucial and should be strictly followed in all our schools. When I've spoken on this topic recently, I've shared my hope that my own grandchildren would soon be vaccinated. Finally, I can state that my 8-year-old granddaughter Ruby and 5-year-old granddaughter Helena have both now had their first vaccination with nothing more than sore arms to report. I should also mention that for the last year and a half, they've been wearing masks, attending school both in person and at times virtually. One was isolated with her parents when they all had COVID or tested positive last year, and the other one quarantined with her mother in their tiny apartment when her dad had COVID. Luckily, they have all done well. My hope for my own grandchildren and for all of our children and grandchildren is that we can soon get back to ongoing in-person learning without masks or social distancing, isolation or quarantining. However, we aren't there yet. which is why we need to continue to focus on getting all eligible persons fully vaccinated and continuing to use MAP and all the other mitigation efforts that Commissioner Malcolm mentioned. Thank you, and I'll turn it now back to Mike.
Thank you, Doctor. Operator, we are ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone keypad. Again, that is *1 on your telephone keypad. To withdraw your question, press the # key. Let us stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson from the Star Tribune. Your line is now open.
Yeah, hi. I wanted to ask with regard to infections in schools. Sometimes you characterize schools as like the incubators that fuel community spread, and sometimes I've heard you say that those schools are more just reflective of the existing spread. I guess I'm wondering how much schools are fueling the overall community transmission, and beyond schools, if there are other areas. I mean, we talked about bars and restaurants before. If there are other areas that are like super spreader events that are a particular problem right now.
Well, thanks, Jeremy. I'm going to ask Chris Erzman to jump in here, but I think your question kind of gets at the answer. I think that with this degree of viral activity all around the state, transmission is happening in a lot of places, and the risk now of transmission whenever we gather is higher than it has been for quite some time. But as to the specific role of schools, Chris, I wonder if you have anything to add.
Sure. Well, just a couple of things, Jeremy. You kind of mentioned the concept of super spreader events, and I think we want to keep in mind that Delta, with its exceptionally, better transmission, sort of is a super spreader event in and of itself. You know, we've talked about how every case is expected to beget 7 additional cases. So this is so much more transmissible than the original wild strain that I think we want to keep that in mind when we're thinking about this particular variant, that it is in and of itself almost a super spreader. In terms of, what's happening in the schools, I think that the schools did serve to reflect what's happening in the community, but because our schools really reflected, especially elementary schools, a population that was not eligible for vaccination until just, over a week ago, there was opportunity for so much more transmission in that setting. And so I think it is a combination. What's happening in kids is reflecting what's happening in the community, but because it is kind of a unique group that hadn't been able to be vaccinated before, it did also serve as a really great opportunity for transmission and spread. So it was introduced to schools because it was in the community, and then the schools, because of that unique population, made for a place that spread could happen, and it just reinforced what we were seeing and has continued to help this community transmission, these very high numbers that we're seeing happening right now. Over.
And a follow-up question would be we talk about Minnesota's cases as a whole, but if you look at the state, it's a patchwork right now. There are portions of the state with really high rates, and some of them have low vaccination rates, and there are other counties that seem to have okay vaccination rates, and they're having outbreaks too. Well, then some other counties aren't having very high rates right now. I guess I'm wondering if you're seeing how the virus is spreading through our state, if there are certain pockets that it's moving in right now and where it's headed.
I'm going to ask Chris to comment on that primarily, but again, every county is in high transmission according to the CDC's framework. So I don't think we can say that any place in Minnesota is particularly in great shape right now. But Chris, would you jump in?
Sure. So, when we look at where we're at in terms of, for instance, the case rate per 100,000, which is kind of a good metric to see, how an area is doing, we see that, there are differences by region. And in particular, we're seeing that, the metro tends to be, although the most populous, tends to have the lower case rate. And so the metro's at, for instance, right now is at 62.4 new cases per 100,000. The state average is 70.9. And then you can see that different parts of the state, the central areas at 91.7, the Northeast 78.9, the Northwest 80.2, South Central 73.1, Southwest 68.6, Southeast 70, and West Central 101.5. And so you can see that while the whole state, as the commissioner said, is in a high risk place, we also see some differences by region. And that can reflect, vaccination coverage. It can also reflect, in some regions, I think, they've had their peak, or they've had so many cases that, they're not seeing quite as many, but definitely a range in terms of what we're seeing across the state.
And just a reminder that we consider the high risk level to be 10 new cases per 100,000. So again, just to put a finer point on it, even the lower counties are many multiples above the high risk level.
Exactly. Yes, we are way beyond where we want to be.
Thank you.
Your next question is from Theo Keith from Fox 9. Please go ahead.
Hi, Commissioner. So last Friday, the governor told some of us at a news event in Minneapolis that this was going to prove the worst of the surges. Do you agree with that? Is that going to happen?
Well, I think from our conversations, I think the governor is particularly commenting on kind of a combination of the case levels and the very tight hospital capacity. Even when we had higher numbers of cases in the depth of the surge last fall and early winter, the capacity shortages tended to be shorter in duration. Was driven a lot by staff temporarily out with COVID or caring for someone with COVID in long-term care or in hospitals. And that situation is different now. The staffing shortages are much more structural, much more permanent, at least in the current situation, not driven as much by absenteeism as just by having less staff available. So I think he's probably talking about the combination of those two things. Certainly, we are alarmed by the numbers that we've seen in the last week, and it looks as though, at least in recent days, the pace of growth is picking up and starting to look like that vertical part of the curve that we saw last fall. So we certainly hope that we're not going to see cases at that level, but given where we're sitting right now with the case trends, we can't rule that out. But I think it is a combination with the state healthcare capacity that the governor was commenting on.
Okay, thank you. And if I might just follow up on something you mentioned during the opening, while it is your hope that the feds expand vaccine booster access to all adults, are you saying that by the end of this week, any adult in Minnesota will be able to get one even if feds don't act, because you will? Will that happen by the end of the week, where someone can walk in and get one?
That is our intent, yes. That we are concerned enough about the surge, and our own data suggests that breakthrough cases are growing, not unexpectedly, and the data are so compelling on the value of boosters to increase that level of protection that we think it's quite urgent to move. We hope and expect that will be coincidental with, or timed, coincident with the federal action. But we have signaled our intent and have communicated that to our federal partners as well, that as other states are doing, we intend to go ahead by the end of the week, but are hoping very much that's a federal standard.
Okay, thank you.
Next question is from Bill Werner from Minnesota News. Your line is now open.
Thank you. Commissioner, you and your colleagues are painting a pretty grim picture. How close are we to requiring some sort of emergency action? And you know what I'm talking about there, a redeclaration of a peacetime emergency. And if we're not to that point yet, why are we in better shape than we were when we did have a peacetime emergency in place?
Great question, Bill. And I think the key difference is that we now really do have the tools that we need to be able to respond to this surge. We as individual citizens and as communities, we know what we need to do. And we have the tools, especially with vaccination and continued widespread testing, to take the needed actions. So our job, we feel, is to give Minnesotans the tools they need to do the things that we all can do to blunt this surge. So the fact that we have vaccinations now, we didn't during the big surges of last fall, I think is a really critical difference.
So are we anywhere near the point where we would be at an emergency situation where a declaration might be needed in your assessment?
All I can really say, Bill, is that we are not anticipating a peacetime emergency kind of situation at the present time. I think, the governor has always said he never rules that out, but we very much think that we're in a position now where, even as concerning as these case numbers are, we have the tools to do what we need to do. We just need Minnesotans' help to apply them. And it's our job to make sure they have those tools readily available.
Thank you, Commissioner.
Next question is from Catherine Richards from Minnesota Public Radio. Your line is now open.
Yeah, I just want to jump off what Jeremy asked earlier. I think Dr. Berkowitz mentioned that we're seeing more and more school clusters. I know just in my life, I know a lot of people who've had kids who are sort of caught up in these clusters. Are you seeing any distinct pattern between schools that are taking all the mitigation measures that the CDC and the state is recommending versus schools that are not, in terms of the size of those clusters or big school-related outbreaks?
Catherine, I'm going to ask both Dr. Berkowitz and Chris Erzman to comment on that. But just to begin with, I think we've talked before on these media briefings about the CDC data. The study that was done just came out within the last couple of weeks, or several weeks at least, that showed that schools without universal masking in particular are 3.5 times more likely to have outbreaks than schools that are using that mitigation strategy. So that's national data, but I'll see if first Dr. Berkowitz and then Chris, would you have any comments on patterns in the schools?
I just Dr. Berkowitz. I'm going to defer to Chris because I think she's got more than specific information. What I would be relating is the same thing that Commissioner Malcolm just did, which is any of the studies that have come out that show the more the mitigation efforts you're doing, the better your chances of limiting spread within a school. But specifics, I'll defer to Chris.
Thank you. And this is Chris, and I don't have any, real specific Minnesota data. Just the fact that, when specific studies have been done, whether it's the school setting, whether it is the community setting, whether it's in, air transportation, any of those settings, the data show that when masking is implemented, it makes a difference in reducing transmission. And so, I guess I'll reiterate what the commissioner said, which was the study that CDC did that found that schools without a mask requirement were 3.5 times more likely to have COVID outbreaks than schools with a mask requirement. And I think that's significant because we know that there's transmission within the community as well. So the fact that masking in the schools can still make a difference shows that it is a significant, it does play a significant role in reducing transmission. Over.
Sure. And just to follow up, I guess I'm also interested to know if you all have any advice for people who are anticipating seeing elderly relatives over the holidays or visiting nursing homes, given this latest surge. I mean, would you just recommend against it altogether, given all these variables, or is it something that people can do safely?
Chris, do you want to just kind of reiterate some of what we have said most recently with the holiday gathering guidance?
Sure. So I think a couple of things, you know, it's best if people are gathering, if you have a fully vaccinated group. So for instance, if you're someone, who's fully vaccinated, you have a loved one who's in a long-term care facility that you would want to visit, you know, knowing that you're fully vaccinated, that you're masking when you're going to see them. And if you're concerned that you may have had, you know, an exposure, you can always be tested prior to that as well. Our guidance for the holidays is really a continuum. And what I mean by that is we're referring people to the CDC guidance, which, you know, talks about safer choices that you can make. And so there's some things that you can do, you know, that are safe. And then there's additional, you know, it remains that layered mitigation. But I would say that, you know, if you have an elderly relative who is, you know, at very, very high risk, you want to consider, are they vaccinated? Have they gotten their booster? Is your family vaccinated? Will you be wearing masks? All of those things to do what you can to make sure that you're protecting that individual. And obviously, if you're not vaccinated, then I think, you know, you want to be thinking about all the things that you can do to minimize transmission to that individual, including perhaps testing before the holidays.
Your next question is from Pioneer Press. Your line is now open.
Hi, thank you. Going back to a little bit on what Bill Werner said, last time that there was strict things that the governor put in place when the emergency was still there, it was largely in response to the hospitals screaming, "We are getting full, we need help." Are the hospitals sending you that message? And if not, if they do, then will the governor change their tune about your current posture?
Well, I think, you know, the situation remains something that we have to watch very carefully and respond to as it evolves. We're all hoping that this recent surge that we see has a limit to it, and that we don't continue to progress at the same level. I think that you know, I would just reiterate again, there are a lot of things we as individuals and communities can do. We've also pointed out to the legislature a few things that could help give some flexibility in the capacity situation. And when it comes to, you know, statewide measures, I think the legislature has been very clear that they want to be involved in those decisions, and that remains something that we're eager to do, is collaborate more closely with the legislature. So I would say we absolutely will continue to monitor the system and talk with our health system leaders, as we do very, very frequently. But again, just want to reinforce that there's so much control we do have in where this pandemic goes from here, that we're just really urging Minnesotans to take advantage of the tools that exist, specifically vaccination and testing and paying attention. I think Chris just described very clearly and very well the ways that we can all consider individual risk situations and make safer choices.
Just a quick follow-up. I mean, with all due respect, the legislature is not going to do anything. I don't think I am going out on a limb and long odds in saying that. Maybe I'm wrong. Do you feel like Minnesotans are going to change their behavior, that vaccinations are going to noticeably pick up based on what you're saying, or haven't the last 9 months shown us that people are sort of set in their ways?
Well, we certainly hope that these recent numbers and kind of the stories that we're hearing, and hospital leaders are speaking out to their patients and their communities about the need for the community's help in getting vaccinated and taking precautions. And you've seen more and more of those stories from all around the state. So I think that will continue, that plea for community awareness and community action. I think there is, I can't comment, on the likelihood either of legislative action, but it sounds as though there's some general agreement on some of the things that could be done in a pretty straightforward way. So that, and your point about will our Minnesotans set in their ways, and if that's the case, will mandates help that situation? I think that's always a question that you weigh. But again, I would just say it's a situation we continue to monitor very carefully, and we'll certainly keep you all posted on kind of what, as we have been doing, what the trends are looking like and what additional actions we're urging.
Thanks.
Operator, we have time for one more question.
Your next question is from Steve Karnowski from Associated Press. Your line is now open.
Yeah, hi, thanks. Just kind of going back to a bigger picture here. I mean, what's your take on why Minnesota's spread is so much worse than everyone else's right now? I mean, are we actually doing something wrong, or is it just that the virus is already burned through states that have lower vaccination rates? I mean, why do we feel so bad against the rest of the country?
Well, that is a question that we would love to have more insight into. I think when you talk to national experts and international experts, there are some things about the patterns of this virus that are not that easy to explain. We're seeing that in other cities and other countries, even around the world. One theory is that our cases, our growth has been slow and steady since the middle of July. It's kind of built on itself in a slow and steady way, and now we're sort of hitting the highest rates of transmission at the very time when we're going back indoors, and also this kind of waning immunity phenomenon. Our later surge is coming at a time when most adults, particularly those over 65 or with underlying health conditions, or even down to the age of 18, the majority of us have been vaccinated more than 6 months ago. So the waning immunity phenomenon may have some relevance here, specifically here in Minnesota.
That ends our question and answer session. I'll turn the call back over to the presenters for closing remarks.
Thank you. That is all the time we have for today's call. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will talk with you again soon.
That concludes today's
Students with ADHD save 10 hours studying with this Chrome extension. But no.